Absolutely. So we'll go on to Shockwave, and I'll just play this video. So this is one of my patients.
My name's Suzanne. I'm a personal trainer for Athletic Development Club, and I have been suffering with tennis elbow in both of my arms since last April. I heard about Shockwave Therapy through R&D Physio, and I am slowly reducing the pain in my arms. Unfortunately, because I lift weights a lot, it's a slower journey than I would have liked, but it is slowly getting there. I can definitely feel a difference.
Great. So I'm not going to sort of play that because we didn't. I'm sure we didn't pay her to do this video for us, but she's really benefited. So this is a sort of mid-40s patient. Does a lot of weightlifting, plays a bit of tennis as well, and is a classic presentation. Now I'm very passionate about Shockwave because I do believe it's got a place in elbow rehab. Now, just a quick brief sort of overview. This is what the machines look like. This machine here is known as the radial, which most clinics have. And this kind of penetrates around 3 to 4 centimeters at max on different setting. This one is quite painful. So radial is quite painful. It does stimulate the healing process. And again, the way to think about it is that it's a sound wave going in and around the tendon site in the area. One, it can help reduce pain for sure, but two, it's bringing some extra blood flow to the area just to kind of help that sort of healing process. Now we don't use straight away, so we wait at least 4 to 6 weeks. Once things become a bit chronic, that's when we'll start using it. This is my favorite sort of approach. So this is only a 2-session or 3-session approach, which is a focused. It's very sort of pinpoint, hence the name focus. And again, seeing really, really good results with this in our London clinic. Now, some people have had Shockwave treatment. I know there's some on this webinar who've had Shockwave, but the problem is they don't necessarily have the rehab after. So you've got to do some high level loading on this. So not just by lifting some resistance bands, initially, yes, it might be working, but I get, 4, 5, 6, 7, 10 kilos being passed through the elbow because that's the amount of load you need to put there. And then the focus is not just by doing one exercise, it's by doing a whole set of exercises to make it specific to the person's sport. So if it's a tennis problem, it needs to be linked back to tennis. It can't just be, here's a piece of band, do these exercises, do some stretches, and that's it. And then, like you said, a holistic view on the injury. So if someone's really sort of, keen to get back into the courts, it helps the mental health. We've all sort of felt it, and we're all excited about sort of returning back to sport. But just go back, just knowing that you don't want to go basically all in straight away and then pick up an injury that's going to wipe your rest of the season out.